Ministry of Health has issued a public alert to take precautions against the spread of Mpox following a significant surge in cases. As of now, 1,712 infections have been detected across 73 districts, with 1,089 individuals having recovered. The outbreak was first confirmed in July 2024, with 2 cases reported in Kasese district. Since then, the disease has spread rapidly, particularly among commercial sex workers in areas like Bwaise and Kawaala in Kampala Metropolitan area.
Unfortunately, 10 lives have been lost, with the majority of these individuals having underlying medical conditions such as HIV/AIDS, malnutrition, diabetes, and sickle cell disease. As of today, 169 individuals are receiving care in designated isolation and treatment facilities.
Mpox is primarily transmitted through body-to-body contact, and its symptoms include fever, body ache, and runny nose, skin rash, swollen glands in the neck, armpits, and groin.
Starting with the, rashes, which can begin as a red mark, usually starting on the extremities of the body, the hands, and sometimes in the private parts. These go on swelling. They become several in number. They can occupy the entire body. They may have pus subsequently, and when they start drying up, at some point they look like donuts. They have a crusted tip, and these at some point may, because of scratching sometimes, because they scratch, they itch, they pain, then you expose them, then you can have secondary infection.
The Ministry of Health has identified the following groups as being at high risk of transmission.
Commercial sex activities in these areas seeded the outbreak in parts of Kampala Metropolitan area, including Kawempe and Lubaga divisions, as well as peri-urban areas of Mukono and Wakiso. The Greater Kampala Metropolitan area, comprising Kampala, Mukono, and Wakiso, remain the epicenter of the outbreak, accounting for 73% of the total cases. The established pockets of transmission in some places in Kampala Metropolitan area are characterized by an intertwined web of commercial sex activity and male Boda Riders, commuter taxi drivers, vibanda workers, roadside vendors, and female bar attendants.
To curb the spread of Mpox, the government has implemented various measures, including raising awareness, regulating brothels and massage parlors through screening, among others.
The Ministry of Health is implementing the following measures to contain the outbreak. 1. Enhanced surveillance, active case search, contact tracing, and strengthened laboratory diagnostics. 2 is public awareness campaigns, dissemination of information of Mpox prevention, symptoms, and early treatment through community health workers and media platforms. 3 is capacity building. We are training health workers in case management and proper use of personal protective equipment.
So our guidance is to ensure screening and early referral of these individuals, and any other practices that lead to contamination.
Collaboration with international partners such as the US government, which has provided over 10 doses of vaccine.
That's been made. Our administration has committed to and donated 1 million Mpox doses for affected countries. And this donation has been put into a pool of donations that come from other countries such as Canada, the EU, the Gavi, and Africa CDC. These doses have been put into a pool, and that this access and allocation mechanism decides which countries will receive them. And Uganda is, as has been said, will be receiving an allocation of 10,000 doses within the next few days. And it's important to state that these vaccines are safe. They have been rigorously tested through clinical trials over years, over thousands of individuals, and have been approved by the U.S. Food and Drug Administration, but also qualified and approved by the WHO.
The public is urged to take precautions and report any suspected cases to the nearest hospital. Naguja Serena, NSTV.
Madam Minister, you talked about the local government regulating brothels